So one thing about routine oral care that I wish more patients would understand is the connection between your oral health and your overall health. There's been plenty of studies done that have shown the connection between periodontal disease and over 50 different conditions, systemic conditions in the body. There's a lot of connections between cardiovascular disease, diabetes, preterm labor and low birth weight babies for pregnant women, all in people that have periodontal disease and these specific types of bacteria in their mouths. So I wish that people would realize that taking care of your oral health is taking care of your overall health at the same time. So it is not normal for your gums to bleed when you're brushing and flossing your teeth. The reason that this happens is because we get plaque on our teeth that develops there from leaving behind things that we're eating that we're not quite getting brushed off of our teeth. This plaque is filled with different types of bacteria and debris that just sit up near your gum line, causing inflammation. That's gingivitis. If we let this sit on there for too long, we can start to see our gums get more and more puffy. That's what causes them to bleed. We can even start to transition into periodontitis, where we start to lose bone around the teeth. When we start to lose the bone, we're losing the supporting structure in our teeth. So that can lead to tooth loss over time. So we want to make sure that if we are seeing our gums start to bleed when we're brushing, flossing, we get in to see a dentist to help clean off all of that tartar and bacteria that's up underneath your gum line. A lot of people think if their teeth look and feel fine, they don't need to come in and see a dentist. That is a common misconception. You shouldn't really feel your teeth. You shouldn't know that they're there. They should be there to help you smile, help you chew, everything like that. Once you start to feel pain in a tooth, that decay has often spread quite deep into the tooth. If we can catch things when they're small, we can do small treatment to help prevent the decay from spreading. Once that decay gets towards the nerve, starts to cause pain, we have to do much more invasive treatments, things like root canals and things like that. So just because things look and feel fine does not mean that you don't need to get in to see a dentist. So while tooth sensitivity can definitely mean that you can have a cavity, that's one of the causes of the sensitivity, it's not the only cause. There's a lot of other things that can cause tooth sensitivity. One of them is clenching and grinding of your teeth and wearing away at the enamel. The enamel is that really strong outer protective layer of the tooth, and we only get so much enamel. Once we wear it away, it's gone. We expose that second layer of the tooth, which is the dentin, and the dentin is much more susceptible to wear and much more sensitive than that enamel is. So that can be another cause of sensitivity. That can also cause gingival recession, and then our roots are exposed in our mouth. Again, those aren't covered by that really strong protective enamel, so that can lead to tooth sensitivity. There are other things like recent dental work, crowns, fillings can lead to temporary sensitivity, but if you're experiencing anything, definitely get to a dentist and get that checked out. A lot of people think that they can just use mouthwash and replace some floss to get your teeth nice and clean there, and that is a common misconception. When we are just using mouthwash in our mouths, we are swishing it. It is getting to some of those areas that your toothbrush cannot get to. But what actually helps clean the debris off of our teeth is that mechanical motion of using the floss and that motion of the floss touching up against the sides of the teeth as you form that C shape around each one of your teeth to sweep away that debris there. And if we don't do that, if we leave that debris on the teeth, it can lead to cavities, it can lead to bad breath, just a lot of situations nobody wants. So it's a common misconception that fillings will last forever. They won't last forever, but can get them to last for quite a bit of time for you, as long as a couple things are happening. One, we need to make sure that you are keeping up with your home care. So meaning brushing, flossing your teeth the way that you should. Also paying attention to your diet, what you're putting into your mouth. So things like sugars and acid and things that can cause cavities in the beginning can also cause the failure of restorations. We also like to bring you into our office for regular recare appointments. That way we can check up on the work that was done, make sure we don't see any fillings that have started to debond or any areas that we can get in there and help keep things nice and clean for you. Teeth whitening, as long as it is something that is recommended by your dentist or by the American Dental Association, is not something that will damage your enamel. All of the products that we recommend that you use are things that are safe for you to use on your teeth. I would not recommend going out and following the recommendations of someone who is not a dental professional. So things like brushing your teeth with charcoal or something that is extremely abrasive, that can have detrimental effects on your enamel. But as long as you're following something that is recommended by your dentist or by the American Dental Association, you should be good.